Hi, I'm Dr. Heath Travis with Travis Chiropractic in Tulsa, Oklahoma. And today I want to talk to you guys about what you can expect at a visit at our office. Every office is different, and a lot of people are really apprehensive about going into any new doctor's office, especially a chiropractic office if you haven't experienced that before. So I just want to take a few minutes today and let you know exactly what goes on, what you can expect, and how we'll take care of you. So whenever you come into our office, the first thing that we're going to have you do, just like you do in any office, is fill out paperwork. Sometimes it can feel a little bit overwhelming, but it just gives us a chance to look at your history and really have an idea of where we're going with you. There's a lot of things that go into diagnosis and how to help someone, and a lot of that information comes from your history and what you can give us. And it's all important. You know, you may be having a specific pain right now, and it may be from an injury. That's obviously very important to know what happened. Is it a car accident? Is it a slip and a fall? There's a number of those things. But you may just be coming in with a chronic pain. You've had low back pain for years and years, and there's no real specific incident. You can't think of anything that you think matters, but it all matters. It matters, past traumas from years and years ago. It matters your health history, some of the stuff you deal with on a daily basis that you think, oh, that has nothing to do with my back pain. Your family history. There's things we see within families over time that can play a role in spinal health. Your diet, your exercise routine, how you're sitting at work, how you're sleeping, what do you do when you get home? All these things play a really important role in helping us decide, number one, what's wrong, but number two, what do we need to do to get you better, and what kind of things may we implement moving forward to keep you better and improving on a consistent basis. So we have you go through that first part of paperwork, and one of those sheets definitely includes a pretty extensive health history just to know anything you've dealt with in the past. And, a lot of times people aren't thinking about their past history right now when they're in pain. So this also helps bring up some things that you may have forgotten about, which again plays a huge role. And then our HIPAA forms are in there, so just privacy that we do protect your information here at our office, and we're going to make sure that doesn't go anywhere that it should not go. So after you fill out all that paperwork, my staff will bring you into the office so we can sit down, and you and I will sit down together and we will work through that history. I'll find out what's going on, what do we need to do, how can we help you, what are you experiencing? And from there we'll decide, hey, yeah, this is definitely a case I think I can help you with. Or there are instances where we say, no, this is a case that we're going to also bring somebody else in on, or whatever that may be. So once we figure out exactly kind of the first steps of that, then I will decide, okay, this is what's going on. These are the tests that we need to further explore this, which, that may include x-ray for many of our patients. That gives us a chance to look at the actual structure of the spine. And, we can see any degenerative changes. We can see any acute injury type situations. Posturally, we can see how you're standing on a consistent basis. There's a lot that we can learn from that x-ray, and we don't use that completely to diagnose you. What we use that for is to back up all the other information that we're finding with your history and with your exam. So if you need films or x-rays, we will take those in our office. We have a digital x-ray machine. It's very, very high quality and takes excellent pictures that day. And literally, they develop that instant. And then from there, we're going to perform an exam. So we're going to go in, depending on what's going on with you, and run very specific orthopedic tests, neurological testing, range of motion, just different things. How do you move, in your neck if you're having neck pain? Does this cause pain? Does this cause pain? Back and forth, does this bring up a completely different symptom? All of this stuff matters. So we go through this testing, and from there, we will, and if there's something I can do that first day to bring you some relief, we will. Generally, it's a very gentle stretching type motion just to open up some motion back into the spine. From there, I will take your exam, your x-rays, if we needed to take those, and your history, and I will sit down and put everything together. So then I'm going to bring you back into the office, and you and I are going to sit down, and we're going to tell you exactly what's going on. What do we need to do to help you? How long is that going to take? And then we'll cover any kind of finance talk at that point. We're very upfront in our office, and we don't pull any surprises. So we give you exactly what you need to know before you make a decision of, hey, yeah, this is something I want to do or not. So we try to paint you a very vivid picture of that experience. From there, I sit down and I present all this to you, and you say, yes, I definitely am ready to get started. Then we go to the adjusting room, and we do a very gentle technique called specific prone. It's a very light adjustment. We start to reintroduce motion to your spine and start that adjusting process. And then we have different therapies that we do in the office. You may or may not need those. And so that's something we'll put with your treatment plan to get you on the road to recovery and, feeling better and improving. So again, this is just how the general flow of our office works. And at any time if you have a question or something, a concern that you want to discuss, myself, my staff, we're always very, very happy to discuss every bit of that. We want you to be comfortable because, as we're comfortable, healing becomes a lot easier thing. So any questions, please don't hesitate to call us at all. Our phone number is 918-296-7587. You can also go to our website at tulsafamilychiropractic.com. And again, we're at 101st and Riverside in Tulsa, Oklahoma, and I look forward to seeing you guys soon. Thank you.